the happy mother of a girl with phenylketonuria, Roxana Iulia. If you can say that such a diagnosis in Romania can be a happy thing. Why? Because in a country where there is not being made a generalized screening to diagnose the disease, I had the incredible good luck to bear my daughter in a maternity where the tests were being made. And now, I can get the dietetic products from my country. And now, the Ministry of Health provides finally treatment for PKU. When my daughter was 6 weeks old, I was hospitalized at the PKU Center in Cluj for analysis. The diagnosis was then confirmed. To inform myself, I asked the doctor for a book about PKU. I got the proteic substitute from the PKU Center in Cluj, and also the information that in Romania goods for this diet cannot be found. Soon I was going to find out how desperate such thing can make you. I bought flour, pasta, and other low-protein products from Germany. When my girl was 9 months old, I remained without any proteic substitute. I went to the Ministry of Health in audience. It was impossible for me to buy it. To have a PKU baby in your arms and not to have the food that her life depends on is horrible. The situation repeated itself every year. I appealed to people from abroad to get the substitute of which the life of my baby depended on, even though I didn't have enough money to buy it. Annually, the PKU Center in Cluj provided me 15% of the substitute necessary. The doctor was giving me smaller amounts than what my child needed due to the lack of substitute. Being now satisfied with her physical development and finding out from books the real diet, I tried to suggest to the doctor that she needed other quantities. Her answer was definitely not. That is not true. The proteic substitute have not connection to the physical development. What did I do? I stopped arguing with the doctor, but I didn't respect her instructions regarding the quantities of substitute. I respected the numbers from the books, and I continued providing it from abroad secretly. In the first years, at every hospitalization, the doctors were looking amazed at my daughter and at me, and they were asking me skeptically, "Is she normal? Is it just an impression, or is she really normal?" Yes, she's normal. At every hospitalization, I was afraid that being so normal, the doctor may realize that I could have another source from where I could obtain proteic substitute, and they could not give me the 12 cans of substitute that they were giving me annually. I was afraid that they would ask me where I got the substitute from. Fortunately, it was out of question. In 2005, the PKU Life Romania was set up with the help of Caritas Catholica Oradea. So I woke up in one day being the president of this association because I was thinking about the destiny of PKU children, diagnosed or undiagnosed, born or still unborn. I wanted all the children to have a good loaf of bread on their tables, to know about the existence of the bread, pasta, and sweets which is for them. I wanted to inform the mothers about how important the diet is, how important the substitute is. The doctor had never told them about the real importance of the substitute, but they were criticizing the mothers because they were not respecting the diet. So I abolished the myth of the PKU diet without substitute. Now Roxana is 16. She seems to be a teenager as any other. She is a teenager who can experience happy moments of her age. But to how many kids the childhood will be stolen, and how many families will suffer until the PKU screening will be done in all the maternities in Romania?
Thank you so much for this moving report on PKU in your country, and compliments for the work you have been doing to improve the situation in your country.
Thank you. And here I have the association story. The PKU Life Romania Association was founded in October 2005 with 11 members, and now it counts 51 members. The targets of our association: steps to the ministry to generalize the screening and the assurance of treatment and medical assistance for PKU children and adults, and assurance of dietetic products for the diagnosed people. PKU Life Romania is member of ANBRARO, National Alliance for Rare Disease from Romania. The implementation of the screening for PKU diagnosis is among the objectives of the National Plan for Rare Disease in Romania. The PKU screening was begun in 1976, and now this is the situation. 2011 newborn tested for PKU, 70%, untested, 30%. The situation of the PKU treatment: the number of the affected people about PKU statistically is 900. The number of the diagnosed PKU people, 180. And the number of the treated PKU people, 51. The mental development to the PKU Life members: from the total numbers of children, just 5 children we have with normal development. The PKU patients can buy dietetic products in Romania from the year 2009. In Romania doesn't exist any PKU adult with normal psychic development. The PKU adults weren't treated until 2010. In 2 of the 4 PKU centers, the periodic tests to verify the phenylalanine level from blood are not done. For the adults, these tests are not done at all. Because of the social dimension of diagnosis and treatment of the phenylketonuria, there are necessary measurements to assure to the PKU people a normal life. Here photos with our children. Cooking studio, Radia, specialist from the PKU center from Hungary. Thank you very much.